you have to think about really the treatment paradigm for a lot of ankle injuries. So before DOS, there was nothing between a really good semi-rigid type of ankle support that you would dispense in your practice and either nothing or something very poor that somebody would purchase in a pharmacy or a surgical supply store, like some just neoprene type slip-on brace. And now with the introduction of DOS, you now have this brand new category of really a combination of a sock and an ankle brace / cage system all in one. And that's what makes this really so unique more than anything else. Because it was very difficult to find. I'm doing this 30 years. What happens after I take the patient from a rigid type of ankle brace, like something put out by other companies that have supports along the lateral and medial malleolus, to nothing? And that's what makes this so good. So let's break that up into two different things. Let's talk about, I don't want to say the elder population. Let's talk about now what's become the boom in the, what do they call me, a Gen Xer, a Gen Zer? I don't even know what the heck I am. My generation moving forward. Now the big thing has become pickleball. And I will tell you that injuries from pickleball have become the #1 injury-related visit in my practice, without a doubt. Now, how does DOS relate to that? This is a type of support or type of brace that controls the foot and ankle in the medial to lateral movements, and with inversion and eversion of the heel and at the ankle joint. And think about something like pickleball. As little as maybe as players move in pickleball, they're doing a lot of medial to lateral movements. And really, that is what this is made to start to control: medial lateral movements, just like any other type of ankle support. Again, better than anything you would get in a pharmacy, not as restrictive as some types of ankle supports that we may dispense in our practices. So this has been a real game changer, for lack of a better, no pun intended, when it comes to using this with patients playing pickleball. Now, should it be used just by everybody as an ankle support? Well, the answer could be yes and no. The no side is, does everybody need this type of ankle support and ankle and heel stability? Well, maybe not. But what's also great about DOS is the sock itself. So since this is a brace and a sock combination, the sock itself is a compression sock. It has a gradient of compression that also helps to just sort of give you that sense of compression also on the foot and ankle. So I definitely feel that this is something that can be worn each and every day. I'll give you a perfect example of that. I had a patient yesterday who I dispensed DOS to, and he says to me, I'm having this problem with my ankle when I'm playing basketball and when I'm playing soccer. But, sometimes I'm also feeling this sort of instability just every day, walking around and doing my everyday activity. And that's the perfect example of why you can be using something like this as an everyday thing. The cage system itself is very soft and pliable when being used in an everyday scenario, but sort of stiffens up when put under stress and what it's needed for when the weekend warrior kind of uses it. Let's talk about now high school athletes and college athletes and things like that, why this is so good. And one of the things that I'm focusing on in my practice is the high school athlete, because I will tell you, I'm in an area where sports is a huge part of, the children and the young adults here in my area in New Jersey. And the high schools, for instance, let's just take the high schools. They don't have enough people. They don't have enough staff, enough certified athletic trainers to truly provide what might need to be some stability for all of the high school athletes on a football team during practice, during games, whatever it might be. And this is a great thing. So what my thoughts are is I'm going to now take this and introduce this to the athletic department in all of my local high schools. I'm very lucky in my area. I have several very close by. And this is a great device for the young adult who is playing a sport that he ultimately can injure them. He or she can injure themselves if they don't have some type of support. And it doesn't have to be football. It doesn't have to be basketball. It can be gymnastics. It can be volleyball, men's, women's, lacrosse, men's, women's. It doesn't matter. This is the type of device that all younger athletes can derive benefit from. I know that was a real long-winded answer, but really that's what makes this so good. I mean, what's again so unique about the brace itself is the cage system itself truly mimics a lot of the anatomy that we are concerned with when talking about ankle injuries. Stabilizes the Achilles. The cage wraps around the front and is in the correct anatomic area for both the medial and lateral ankle ligaments. So something like this can truly give you true anatomic support without, people always try to put ankle, ace wraps on, and they always put them on incorrectly. This is was created in such a way that it really mimics the anatomy there. And it's not just a singular brace, it's multiple sizes and it's right and left. So really it's great. You dispense what the patient needs, just like you would in any other type of brace, but it's much less bulky. It's really anything because, I'm very lucky. My practice is, I always say, from pediatric to geriatric. And I have patients who are, the young, the very young kids who are starting in sports, who this is probably not relevant for, but all the way up to the seniors who are staying much more active, in years. So it could be anything from tennis to anything. You'll also find while running, is a much more straightforward motion, plantar flexion, dorsiflexion, and not too much medial lateral inversion, eversion, things like that. Runners who suffer an injury feel great where they have this just great compression to the area. It just provides them the stability. And again, it's not a bulky brace that they're wearing. It's a much more easily fitting sock into their sneakers. And what's great is it's really just, it could be for everyday use. It fits in everything. It's very low profile and it works great. Yeah. So the world has changed dramatically in the last 3.5 years. We went from working in offices to working from home. So whether it's you know, ankle type injuries, plantar fascial types of injuries. People aren't wearing the shoes that they would on a regular basis. So because this is made in such a way that the sock itself is so good and provides compression, that's what's great. For those of us who now work from home, who sit behind a desk and maybe don't get up as much, having a compression type of sock also helps to promote blood flow. Those of us who may have problems where we get not only, a weak ankle, or we get some swelling in the lower extremity, maybe due to some poor circulation. And while I'm not correlating circulation with musculoskeletal injuries, the device itself is made with both components in it. It's made with the cage system for the stability and the compression for the sock. Everybody has ankle type of injuries, whether it is the athlete, the weekend warrior who goes out and is, trying to play a sport on the weekend, or it's the person who is going to work and stepped off the curb and had an ankle injury. I will tell you that my own son, several years ago when he was a freshman in college, stepped off of a curb, didn't look where he stepped. Right off the curb was a small pothole next to a grate, and he ended up with both an ankle and talar dome injury. And he was in a pneumatic walking boot for many, many months. And this would have been perfect for something like that once he came out of the pneumatic boot to the rigid brace and then back to nothing. Having something like this at that to fill in that gap would be great. So don't think about this as a sports related type of brace. There are many reasons that somebody could be presenting to your office with an ankle injury, and it doesn't have to be sports related. It could be related to anything. They could have an injury from an accident. They could have injured their foot in a car accident. Hitting the pedal too hard and twisting the foot off the pedal. So again, there are many reasons why patients present with ankle injuries to your office. So while I just started dispensing it in the office, I can talk about the uniqueness of the product itself. I'd be hard pressed to speak with anybody in the sports world, or physicians who treat athletes, who have anything like this. There isn't anything like this. This was so unique in its development. So not only does it have the cage system, it has straps. So again, there are multi layers here. So I don't think that we need to really show success stories here. What I think we need to talk about is, again, the treatment paradigm of a patient with an ankle injury, and just thinking about what the patient wears from the time they go from a more rigid type of brace back to normal shoes, and something that was needed to fill that gap. And I think as time goes on, we're going to see that this is the device, and this is the brace, and this is the sock that fills that gap where patients would maybe have gone to the local pharmacy or the local surgical supply store and just picked up some type of neoprene, non-supportive type of brace with the cage system, with the straps, around the medial and lateral malleolus, with the compression sock. You have so many different components here that you wouldn't find that in any other singular device. Well, we need to take a step back. Before I talk about how I do it, when dispensing in your office, the big thing that I always talk about, and I focus on one word. And I want to talk about two different things. I want to talk about the one word that I focus on and something else. So the one word that I focus on is invest or investment. You are investing in your practice to bring a product or a device in that would ultimately help your patient. Now, this is not a device. This is not a brace or a sock that is covered through any type of insurance. So how you need to discuss this with your patients is they need to realize that when they use their hard-earned money to get something from your practice, it doesn't cost them anything. They are now investing in their foot health. They are investing in a device, a sock, a brace, a unique product that is ultimately going to help them get back to the activity that they like. And I always tell my patients, I don't care what that one activity is. I don't care if it's sports. I don't care if it's shopping. I don't care if it's dancing. I don't care if it's going to the beach, going out with your friends. I don't care what that one activity is. The more or the quicker that that patient can get back to that activity that they like to do, and they have invested their hard-earned dollars, they're going to see their return on their investment in their foot health. That's number one. Number two, the podiatrist who dispenses this also needs to believe in it. Let's be very honest. Anything that you're going to ask your patients to believe in or to invest in, you have to believe in yourself. When I was first introduced to DOS and I saw the uniqueness of the brace, I believed in it right away because, again, it filled that hole that nothing else, there was no other product there. And that's what's great about this product. So I believe in it. I make my patients understand what their injury is and what we're ultimately going to do for them and what they may need to invest at the end to get back. And then the patient then takes a step back and they say, okay, I see what we're doing here. And I see what my ultimate investment might need to be. And we all come to an understanding that, well, you might need to spend some time in a pneumatic walking boot. You might need to spend some time in a brace. And whether or not they may need to contribute to that through their insurance, that's another story. But making them understand that this type of brace, this type of sock, this type of device is something they're ultimately going to invest in, you have to put yourself in your patient's shoes. No pun intended. You have to put yourself in their place and realize why they came to you, but what they ultimately want to get back to doing. It might be being comfortable commuting to work, to your place of work, in a city. I live in New Jersey. I have patients who commute into New York City, who have to, park their car and walk to the bus and take the bus into New York City, but then may walk to their place of employment. They need to get back to a place where they can do that thing. So it might not be something that's fun, when it comes to working. It's part of their daily life. Listen, I'll let's be honest, I'm here because I believe in this device. I believe in PowerStep as a company and the products that they dispense, or they have for their customers, us as podiatrists invested. Don't just look at DOS as just one piece. Think about, the prefabricated orthotics that PowerStep has that I think are the best on the market. Think about whether it's their flip-flops or whether it's their slippers, people working from home who might have other types of musculoskeletal types of injuries or conditions, plantar fasciitis. They have a lot of different products, but ultimately, the message I want to leave everybody with is, number one, treat your patients like you would want your family to be treated. Have products in your practice that would ultimately benefit your patients. And don't be afraid to ask your patients to invest in their foot health. If you have to come up with canned language or some type of language that you need to have, come up with that. But you need to believe in the product. And if you believe in it and convey the right message to your patient, that you're not just selling them something, you're asking them to invest. And you can see that was the first time, and that I used the word sell, because I'm never selling anything to my patients. I'm always dispensing to my patients. I'm always asking my patients to invest, whether it's this or whether it is a topical product that I also dispense in my practice. They're investing in their foot health. So, to all of the podiatrists who are listening, you should invest in your practice for the benefit of your patients, and make the patients understand that when they spend their hard-earned dollars in your practice, they are investing in their foot health.